The topic name is the aseptic. What is called as asepsis condition? A contamination free, we have to maintain all the type of the equipments and the object or the articles which is called as the asepsis. First one, terminology. We have to focus into the medical and surgical asepsis. What is called as? Terminology means ki whatever type of the topic we are studying before, we have to understand about that proper word. This is called as the terminology, means ki the identification of the language. The acquired immunity host which is received natural or artificial antibody which is produced by another sources, means ki acquired immunity, outer immunity receives the natural or artificial antibodies produced by other or another sources. Second one, active immunity means ki host produces antibodies in response to natural means ki infectious agents or artificial antigens like the vaccines. This is also example of the acquired immunitical factor. Antibodies, antigens and antiseptic antibodies. So like natural antibodies means ki immunoglobulins which is defend against the infections. This is the antibodies, means ki foreign invaders which is attached with the antibodies and fight with each other, which is called as the antibody. Antigens, substance that induces the state of sensitivity or immune responsiveness, which is called as the immunity. Antigens like which is induce sensitivity or immune responsiveness to the immunity, which is called as the antigens. Whatever type of the foreign invader which is attached to the our body's antibodies, this is called as the antigens. Antiseptics. What is called as the antiseptics? Inhibit the growth of some microorganism which their affected area. This is called as the inhibit of the microorganism, is called as the antiseptics. Next one, cross infection. The infections which is transmitted between individuals infected with different pathogenic organism, means infections which is transmitted by the one pathogens to the another pathogens which is going to be transferred by the cross factor. This is called as the cross infection. Carrier means ki a person who harbors pathogenic organisms of a disease in his body without showing signs and the symptoms of a disease, means ki whatever type of the persons we have, the type of the disease have that disease signs and symptoms but not going to be expressive, which is going to be observed into the dormant or the recessive phase, which is called as the carrier. Next one, droplet infection. So it is the infections of individuals by means of fine particles of saliva and the mucus which is expelled means ki transmitted by to the saliva and the mucus from to the nose and the mouth of another person during the coughing, sneezing or the talking. Then after fomites, what is called as the fomites? So like object which have been in contact with a contagious disease which are capable of transmitting the disease, means ki whatever type of the object which have contact with a contagious disease, means ki contagious type of the factor ke through capable of transmitting to the infectors to the other. This is called as the fomites. Next one, medical asepsis. So all the practices intended to conform, limit the growth and transmission of the microorganism with the clean technique, means ki what is called as the medical asepsis? So all the practices intended to confine, limit the growth of the microorganism, transmissions of the microorganisms and this type of the clean technique which is called as the medical asepsis. Asepsis which is freedom of disease which is causing microorganism, means ki who is causing to cause for the disease which is going to be freely contaminated, means ki free from to the contaminated and which is going to be 100% sure. This is called as the asepsis, means ki microorganism free. Like soiled contaminated means likely to contain microorganism which may be capable of producing the disease, means ki soiled dust particles, contaminated particles which contains the microorganism such as capable of producing the any type of the disease. Surgical asepsis, so like practices that keep an area free with all the microorganism, which is called as the surgical asepsis. Sepsis, which is going to be state of the infection, means ki transmit the infections, which is called as the sepsis. Septicemia, semia means ki which is present into the blood, like systematic infections with the bacteria, whatever type of the infections by the systematic, means ki which is related of the physiological conditions, right? Acute infections which is appear suddenly, means ki which is appear by the suddenly, last a short time, means ki the time duration is very short. Disinfectant, what is called as the disinfectant? So agents that destroy pathogens other than to the spore, means ki types of the pathogens which are going to be destroyed other than to the spore. Disinfections not going to be killed by any type of the spore like of the activity, but which is induced or a intimate factor, means ki pathogens destroyed by the spore by the disinfectant. Destroy, inhibit the growth of the pathogens of the spore. Infections, invasions of the body tissue by microorganism and proliferation there. What is called as infection? Invasions of the body tissue. Invasion means intravenous with the body tissue by the microorganism, and the proliferation. Proliferation means ki mature of that infected portions, that affected area. Disease which is detectable alteration in normal tissue function. Disease which is detectable alterations into the normal tissue function, which is going to be altered by the normal functions. This is the disease. Virulence refers to microorganisms' ability to produce the disease. Means ki what is called as the virulence? So which is refers to the microorganism and ability to produce the any type of the disorders, which is called as the virulence. Means ki transferred by the toxical substance to the body's tissue, body's organ. This is called as the virulence. Communicable disease. What is called as the communicable disease? One that can be transmitted to an individuals by direct or indirect contact. Means ki communicable disease means ki one person to another person, which is transmitted by the direct or indirect way. Infection, the entry and multiplication of disease which is causing organisms in the body, means ki infections which is going to be entry and multiplications over there which is causing that infections into the body, which is called as the infection. Fumigation, process of disinfections by exposed to the fumes of a vaporized germicides. Germicidal actions means ki suppress of the bacteria, kill of the bacteria. So fumigation, which is one type of the sterilization process, fumes which is going to be developed over their area and kill that area of the microorganism free. This is the process which is called as the fumigation. Next one, chronic infection. Chronic means ki long term. Infections means ki whatever we have discussed before, which may occur slowly over a long period and may last month or the years. Means ki which is going to be, the process is going to be very slow and the period duration is very long, which is example month to the year. This is called as the chronic infections. Nosocomial infections. What is called as the nosocomial infection? So hospital acquired infection. This is the best example of the hospital acquired infections, means ki HAI, which is the also called as the nosocomial infection. Infections which is developed during the client stay in a facility or manifest right after the discharge. Means ki nosocomial infection developed during the client stay into the hospital premises or the facility, which is going to be discharged with the another type of the hospital acquired infections to this patient, or the nosocomial infection with this patient. This is called as the nosocomial infection. Next one, portal of the entry, bacteriostate and bacteriostate. What is called as the portal of the entry? So how the microorganism enter the body? This is called as the portal. Means ki whatever places the microorganism which is going to enter into the body, this is called as the portal of entry. Bacteriostate means ki agent that inhibit the growth of the bacteria. Means ki whatever type of agents which going to be inhibit the growth of the bacteria, this is called as the bacteriostate. Bacteriostates, which is agent that power to kill the microorganism. Means ki that what type of the agents or the power which is going to be kill the microorganism. Fumigation, again we are talking about the another definition. The process of disinfections by exposure to vaporized germicide. Vaporize means ki evaporation. Whatever type of the gases we are applied over there, fumes that time we are produced over that area, and that area make it free from to the microorganism. This is called as the fumigation. Isolation, separation. This is called as the isolation. The isolation separate of infected person from the non-infected person for the period of the communicability under conditions which will prevent the transmissions and infections to the others. Means ki isolation means ki separated to the infected person from the non-infected persons for a period of the communicability under the conditions which will prevent the transmission of infection to the others. Sterilization, destructions of all the microorganisms, pathogenic and non-pathogenic, including there the spore. What is called as sterilization? So destruct all the type of the microorganism, pathogenic or non-pathogenic, including spores. This is all called as the sterilization. Then after quarantine, you are already aware about this quarantine word. What is difference between the isolation and the quarantine? Nearby it is similar, but the freedom given is the different. Let us focus on its quarantine. Detention or isolations of well person who have come in contact with an infectious disease. Means ki a person who is suffering with a disease, infected disease for a period of time equal to the longest incubation period of the disease. Means ki that incubation time is very higher, and then after with the facility we have to isolate the patient for some days. Example, coronavirus. Coronavirus incubation period is the 14 days and the incubation period is also 14 days. After the quarantine time is 15 days. Right? With the patient is going to be freedom with the another facilities. But they have some limitation time. In a vice versa isolations haven't any freedom to for the freedom to give that facilities. Why? Whenever it is not going to be eradicated of the disease from to that patient, we can't be going to be have to enter in the normal life. This is the difference between the minor difference between the isolation and the quarantine. Incubation period, the period between entry of the pathogens or occurrence of the symptoms of the disease. What is called as the incubation period? So like period between entry of the pathogens and occurrence of the symptoms of the disease. Means ki the entry of the pathogenicity and which is produced the symptom of the disease, that period which is called as the incubation period. Medical asepsis. Let's talk about the first one thing is that medical asepsis. Medical asepsis sometimes called clean technique based on maintaining cleanliness to prevent the spread of infectious disease and to assure that the environment is as free of microorganisms as possible. Means ki environment assure we have to give as the microorganism free, which is involved conforming the microorganism to specific area, making object either the clean or the dirty. Means ki the making the object by the either clean or the dirty, we have to free of all the decontaminated factor. That all the process which is depends on to the decontamination process, this is called as the medical asepsis. Okay, next one. Cornerstones of the medical asepsis. This is know what the type of the dirty portions is there, know what is the clean, what is the sterile, conditions for the separate, and remedy contaminations for immediately. What is the remedy for contaminations of the medical asepsis? First one, principle. Whatever topic you are studying, we have to some principle. What is the mechanism behind of them? Why we are studying over here? So this is the reason behind we are taking about the principle. The basic principle of the medical asepsis include clean the hands, means ki hand hygiene, following the CDC's hand hygiene guidelines, means ki center disease for control, which is the making down of some guidelines. We have to follow over the CDC's guideline. So first, clean our hands, right? Keep soiled item and equipment from touching the clothing, means ki whatever, keep the soiled item and equipment from touching in the clothing. Do not place soiled bed, linen or other items on the floor, means ki whatever we are taking the items which are making onto the floor, it is already going to be the dirted. We have to remove by the aseptic technique. Avoid having the patient's cough, sneeze or breathe directly to the others, means ki we have to avoid patient's cough, sneeze, breathe directly to other patients. More equipment away from you when swiping, means ki sweeping, dusting or scrubbing the articles, means ki whatever equipment away means ki we have to go for some distance, which is going to be sweeping, dusting or scrubbing the article. Clean the least soiled item first, then the more soiled ones. First of all, we have to clean less soiled item, then after more soiled item. Soiled ka meaning means ki dirty particles. Dispose of soiled or used items directly into the appropriate container. We have to dispose of with in a appropriate container. Pour the liquid that are to be discarded directly into the drain to avoid spattering in the sink or onto you, means ki we have to follow some instructions when we are drain out into the sink. It is not going to be revert back onto your body. It is going to be infected to our body. Avoid leaning against the sink, supplies and equipments. Avoid touching your eyes, face and the mouth without hand wash. Use particle of the personal grooming that help to prevent the spreading the microorganism, means ki we have to avoid some grooming, means ki whatever type of the materials which is going to look good, but we have to dress up with very simple without any making our ear just example, we have to not grooming properly, so which is helping to us for inhibit the microorganism for the contamination. Follow your facility guidelines for isolation and barrier techniques, means ki we have to follow our faculties, means ki facilities guidelines for isolation and barrier technique. Barrier means ki connected technique. We have to transfer from one barrier to the another barrier. This is causing reason barrier. All body fluids from any patients is considered contaminated, means ki our body's fluid from to the patients which is considered as the contaminated. The healthcare team and the environment can be a source of contaminations for the patient. Healthcare team and the environment can be source of the contamination for the patient. Isolate the disease not to the patient, means we have to isolate the disease to not to the patient. We have to isolate the disease, not patient. Understand about that. Make a note of here that a medical aseptic practices are involved in all the nursing activities because microorganisms are always present into the environment, means ki all aseptic precautions or the practices which is involved into the nursing activities because microorganism which is always present into the environment, right? Next one, microorganisms are located in everywhere, like in air, in water, in food and in clothes, right? Not all the microorganisms are harmful, means ki all the microorganisms are not harmful. Some microorganisms are help to for digestion in our body. Just example, Escherichia coli, which is colonized into our human colon and which is help for vitamin K absorption and digestion. So this type of the bacteria which are going to be help to for the digestion, which are not all are harmful. Okay, which are some are the help us to digestion and human bodical favor. Some are used to make medications such as the penicillium. Penicillium, which one type of the fungus. So which are some of the medicine purpose we have to make for the antibiotic. Microorganisms can be sprayed by first one. How the microorganism which is going to be sprayed by the first one? Touching someone who has an infection, touching the linen or other belongings of a person who has an infection, sneezing or the coughing, handling or consuming contaminated food, medications or the water. Right, these are the handling or consuming the contaminated material like food, medications or the water. Next one, essential component of maintaining the medical asepsis include hand washing. What are the essential components we have to follow? So these are first one, hand washing. Second one, utilizing gloves, gown and mask as indicated. Means we have to utilize gloves, gown, mask as indicated. Cleaning or disinfections of equipment. We have to clean or disinfection of this equipment. Handling linen in ways that prevent germs for the spreading. We have to handling of this inline portion by the prevent of the germs who is spreading the infections. Surgical asepsis. The surgical asepsis is also called as the sterile technique which is used in the operating room, delivery room, during the surgical process, catheterizations and during the dressing changes. These all are the aseptic matter we have to maintain during the surgical asepsis. Now, third principle. The basic principle include first, only sterile object can touch another sterile object. Means ki only one sterile materials which is touched to another sterile materials because they all are the microorganism free. Open sterile packages so that first edge of the wrapper which is directly away from the workers to avoid the possibilities of sterile wrapper touching non-sterile clothing. Avoid spilling any solutions on a cloth or paper used as the field for sterile setup. Means ki we have to avoid the spilling any solutions on the cloth or the paper which is used filled for the sterile setup. Hold the sterile object above the waist level. Means ki we have to using all the sterile materials above the waist levels. We can't touch directly over the waist levels. Means ki we have to pull it down, not from to the floor. We can't make it down onto the floor. Avoid talking, coughing, sneezing and reaching over a sterile field or the objects. Never walk away from or turn your back on a sterile field. All items brought in a contact with a broken skin or used to penetrate the skin in order to inject substances into the body or to enter normally sterile body cavities should be sterile. Right? Our body's cavity should be clearly free from to the microorganism. Use dry, sterile forceps when necessary. We have to use some dry, sterile forceps when necessary. We have necessary the time we have to use the dry and sterile forceps or the instruments. Consider the edges outer one of the sterile field to be contaminated. The edges which are going to be infected we can't use by directly without sterilization. Consider an object contaminated if you have any doubt as to its sterility. If you have any doubt, if you touch to any substance or any object directly and you are not sure to that, you are directly touching without wearing the gloves, so this is called as the surety. You have to make some surety before using the sterile instrument. Okay, next one. Gowns are considered sterile in front from the chest height and operate the level. This is the way we have to wear the gown and operate the level whenever the operation theater, that operation level, right? Sterile persons should keep hands in a sight and keep them at or about the waist level. Means कि sterile persons should keep their hands in a sight, that the sight factor up to the waist level. Above the waist level means कि we have to above that, not for that. This is the level. Okay. Next one. Contaminations occurs when sterile gowns and draped as permitted. Tables are sterile only at the operative level. Tables have to be sterile before using this operation theater or operating table. All the items used within the sterile field must be sterile. Whatever type of the materials or the sterile portions we have to use, it is must be sterile. That place is must be sterile. Sterile person touch only sterile items or sterile area. Sterile persons only touch the only sterile items or sterile area, not to the other items or not to the other areas. Unsterile persons or the personal stay beyond 1 foot of the sterile field. Unsterilized personalized things which is going to be 1 foot up, means we have to put it down in the another way. We can't touch directly or up waistline. So incidentally, we can't take by this by mistake. When contamination occur, take care of it immediately. Means ki when contamination is occur, take care of it by the immediately. Break-in technique is pointed out and action is taken to change a situation, means ki change the gloves. If you are using or operate some part and touch to the another contaminated substance, so you have to first remove the gloves, wear the new gloves, means ki sterile gloves, and then after being participate into the next operating process. Okay, prevent the excessive air currents around the sterile area, means ki excessive air would be going to be free of that area. Moving fast, flapping of the clothes and the drap. We have to very safely and clearly. We can't do it's very fast, like moving the fast. It is going to be excessive air. It is going to be going to be for that area which are going to be sterilized. So we have to avoid that all the things that things do can go the excessive air into the sterile area. Keep the sterile field dry, means ki the area would be going to be sterile and dry. Each sterile supply should be clearly labeled, means ki each sterile supply should be clearly and labeled. Hold the transfer forceps pointing the downwards, means ki hold the forceps transfer to the pointing to the downwards. Whatever type of the forceps, sterilized forceps which are going to be downwards on this process. Transfer forceps and the containers should be sterile daily, means ki transfer the forceps and the container should be sterile daily. Do not return the unused sterile objects to the container once they have been taken out, means ki one time do not return. If it is unsterilized, we can't taken by the reuse. We have to first sterilize of that portions and then after reuse it over there. Elements of the surgical asepsis like hand washing, opening of the sterile wrapped package, use of the gloves, going means ki gowning, masking and sterilizations of the articles. These are all the elements we have to mention and careful by these surgical aseptic factors. Standard precautions. What are the standard precautions are there? The standard precautions previously known as universal precautions are the practices which is adopted by all the healthcare workers when potentially coming into contact with any patient's blood or the body fluids. Means ki we have to mention by the standard precautions, all the adapted by the all practices or the particles to the healthcare workers and potentially coming into contact with any patient's blood or the body fluids. Whatever type of the object which is going to be contact into the patients like blood or the body fluid, we have to immediately refuse over there and sterile to make it down for the sterility properly. They are a set of principles designed to minimize exposure to and transmissions of a wide variety of microorganisms. Means ki they are a set of the principle designed to minimize the exposures to and transmissions of a wide variety of microorganisms. Means ki that the principal designed things which is exposed with the transmitted with the wide variety, means ki different type of the pathogens through it is going to be transmitted. Since every patient is potential infection risk, it is essential that you applied standard precautions to all patients at all times. Means ki since every patient which is potential infections risk, every patients which have potential to transfer the infections to the other patients and other area, and which is essential that you have applied standard precautions to all the patients at all the times. Now, standard infections control precautions, what are their includes like hand hygiene, protective clothing and equipments, isolations, nursing like transmissions based on the precautions, the safe disposal of the sharp laundry management, clean clinical environment, we have to maintain the clean clinical environment, decontamination of the equipments, we have to decontamination of the equipments, management of exposures to the blood and the body fluids, means ki we have to manage of exposed to the blood and the body fluids which are highly contagious, apply good basic hygiene practices with regular hand washing after touching body fluids and contaminated items. Means ki apply a good basic hygiene practices with a regular hygienist hand washing after the touching body fluids and contaminated of the items. Cover existing wounds or skin lesions, waterproof dressing. Means ki we have to existing wound or the skin lesions with the waterproof dressing with the waterproof. Avoid carrying out invasive process if suffering from chronic skin lesions onto the hands. Means ki avoid carrying out with the invasive process if suffering from chronic skin lesions onto the hands. Avoid contamination of the clothes by using appropriate personal protective equipment. Means ki we have to avoid the contamination of the clothes which are using appropriate by the personal protective equipments. Protect mucous membrane of the eyes, mouth and nose from splashes of the blood or blood stained fluids. Means ki we have to protect by the mucous membrane of the eyes, mouth and nose from to the splashes, the things which are coming out by the blood or blood stained by the fluids. Prevent the puncture wounds, cuts and abrasions in the presence of the blood or the blood stained body fluids. Means ki we have to puncture the wound which is going to be cut or aberrations. Aberrations means ki abnormal in the presence of the blood or the blood stained body fluids. Avoid using the sharps where possible. Means ki avoid the sharp things if where possible. Use the safe handling process for handling and disposal of needle and other sharp. We have to safe handle this process for handling disposable of needle and other sharp things. Use approved process for sterilizations and disinfections of instrument and the equipments. Means ki we have to approve the process for sterilizations, disinfections of instrument and the equipments. Clean the spillage of the blood and other body fluid promptly and disinfect the contaminated surfaces. We have to clean the spillage of the blood and other body fluids promptly, means ki immediately, and disinfect by the contamination of the surface. Institute a process for safe disposal of contaminated waste. We have to institute a process for the safe disposal of the contaminated waste. Follow the statutory requirement for the safe disposal of used and infected linen. Means we have to statutory requirement for the safe disposal of used of the infected linen. Make sure the environment of the patients which is visible, clean and free from dust and the dirt particles. We have to sure that environment of the patients visible, clean and free of the dust or the dirt particles. Wear the non-sterile gloves when touching body fluids and contaminated items. Means ki wear the non-sterile gloves when touching body fluids and contaminated items. Then after we have to change our gloves. Next one, ensure that reusable equipment is not used for the care to the another patient. We can't use the one-time use of the equipment to the other patients. Handle and transport body fluids and contaminated item carefully. Means we have to handle and transport body fluids and the contaminated item by the carefully.